It's incredibly important to understand how pervasive stigma has impacted the care, the treatment, and our societal view of individuals with mental illnesses. Words are very powerful when it comes to describing individuals with mental disorders and how they're depicted in the media, in cartoons, in political cartoons, and in movies. And those images, in fact, have created an environment for individuals who are mentally ill who often do not seek treatment for fear that if someone understood that they were mentally ill, they would lose their friendships, they could lose their job, they could lose their sense of community. And if you ever want to have a stark reality of what stigma looks like, if you were to walk into a general hospital and you walked into the cancer ward, the units are generally sort of colorful. If it's a pediatric unit, right, they're colorful, there's cartoons up, there's primary colors, there's a sense of activity. And then if you walked onto the psychiatric unit, you generally walk into through a locked door. The space is dark, it is white or gray, and the furniture is usually, even in the best facilities, dilapidated. It is a stark reality of an image that depicts stigma in my mind. Stigma is so pervasive in the United States that we use terms. So first of all, we say the mentally ill as if it's a homogeneous group, when we know that people with mental illness range from individuals who are suffering from depression to an eating disorder to an anxiety disorder, or who may have schizophrenia. But when we say the mentally ill, most people think immediately of the 1% of the population that has schizophrenia. That's our image. It's really important that we bust that image and treat individuals with dignity and respect and support their families. Because the reality is families are the #1 provider of mental health services to their family members. I'd like to think it's social workers and psychiatrists and nurses and the like, but the reality is it's families, and families need to also be supported. And when they're blamed for their family members' illness, it does nothing to deal with stigma. It was in 1999, actually, that the Surgeon General stated that powerful and pervasive stigma prevents people from acknowledging their own mental problems, much less disclosing them to others. In fact, I'll tell you an anecdote. I have a family member who has schizoaffective illness, and she once said to me that when she disclosed that to someone, that she could feel the distance between them immediately, that the person literally sort of stood back thinking that somehow they could catch it like a cold, which you can't catch you can't catch a cold like that anyway. But the reality is that she could feel them just distance themselves, and she lost that friendship. And this was a childhood friendship. That is how powerful stigma can be. The majority of U.S. citizens believe that people with mental illnesses will not recover and are to blame for their problems. In fact, many people refer to mental health conditions, as chronic. And the fact is, you can recover from mental disorders. You can work, you can marry, you can have meaningful lives. You're not just subject to a life on the streets and in jails. And the fact is that many people with mental illnesses are not more prone to violence than their non-disabled counterparts, and that is contrary to the images that are displayed in the media. There's a well-known body of research that absolutely disputes the fact that people with mental illnesses are more prone to violence. But because we live in a 24/7 news cycle, if there is a violent act, and if that person either looks odd or has a diagnosable mental disorder, then that gets conveyed that all people with mental illnesses are dangerous. And that is a myth that we need to dispel. The reasons for not receiving mental health services among adults reporting an unmet need, now this is 2009 data, in fact goes directly to the heart of stigma and to the fact that insurance did not cover care. So the primary reason that people did not seek services was they felt that they could not afford it. Hopefully, with the implementation of the Affordable Care Act and other improvements in health insurance, people will be able to afford cost. But as important, the other reasons that individuals do not receive treatment is the fear of that it will negatively affect their job. It might cause others to have a negative opinion about them. Concerned about confidentiality are all very powerful reasons, and that all comes from stigma, fear of that how others will think about them. And these are the reasons why individuals more recently who've talked about their own struggles with mental illnesses and that they've gotten good treatment are so powerful to sort of help convey a different image of mental illnesses for the future. What we've seen with sort of some profound writings from everyone from Bill Styron to Kay Redfield Jamison are individuals who are high profile who wrote about their experiences of mental illnesses and how they recovered from them. The more individuals, when we think about that it affects 25% of the general population, the more individuals are comfortable talking about receiving treatment and getting good treatments, the more and more we will dispel the fact of the stigmas that surround these illnesses. Adults with serious mental illnesses who receive treatment, there's also disparities when it comes to race and ethnicity and income and residence, but particularly around ethnicity. And again, we know that disparities among receiving treatment exist in the United States. But first of all, only slightly less than 50% of individuals who have a need for treatment receive treatment. That in and of itself, can you imagine having a medical condition and only half of the population receiving treatment for that condition? That's what we're talking about. And yet when we peel back the onion a little bit more, we see that whites are much more accepting of treatment and going for treatment than individuals who are Black, Hispanic, and Asian. So we have a lot of work to do to really help individuals dispelling the stigma attached to the illnesses, why treatment is important, and helping individuals receive the treatment that they need. Clearly, poverty, and whether you live in the city or in the suburbs or in the country, in the counties, doesn't matter quite as much. But again, what's important is understanding, one, there's stigma, and two, there's even greater disparities once we understand the differences that exist among other groups. The same thing is true for mental health care for children. So only 60% of the kids who are identified as needing treatment receive the treatments that they get. Again, if you make the analogy to a physical health condition, we would never want to see children suffering from an untreated condition. And yet only 60% of the kids in the United States with diagnosable conditions receive the treatment they need. And the disparity among states is quite significant. And also the disparity among, again, different ethnic groups and races. So if you're white, you're more prone to receiving treatment, and we know there's lots of issues around access and affordability of care versus Black and Hispanic. And why this becomes so pronounced is that we know by the year 2050, Hispanics will be the majority in the United States. You know, we talk about people with mental disorders as if they don't have medical conditions. And one of those sobering moments was when I realized that people with serious mental illnesses die on average 25 years younger than their non-disabled counterparts, and they die from uncomplicated medical conditions, the likes of which most of us will not die from. So people with mental disorders represent about 25% of the adult population, and about 68% of those individuals with mental disorders have a concomitant medical conditions. And one of the things we're coming to appreciate now is that many of these medical conditions are also attributed to the medications that they're taking. Diabetes and obesity being two of the more prominent conditions that we're coming to understand are a direct side effect to some of the medications they are taking. So these are, again, some of the issues that we need to be focused on around some of the consequences of this segregated mental health system. As I've said, I probably overly focus on the fact that people with serious mental illnesses die younger than their non-disabled counterparts, in part because I was the first commissioner of mental health in the country that released the data that showed the consequences of a segregated healthcare system. 75% of individuals are tobacco dependent compared to 22% of the general population. And that 15% of individuals over the age of 50 with schizophrenia have diabetes as compared to 8% of the general population. And that we know that individuals with bipolar illnesses are 50% more likely to be obese. I didn't say overweight, I mean obese as compared to the general population. Some of these conditions we understand to be, as I said, as an impact, a result of some of the medications, but many of these conditions are a result of having sort of this fragmented healthcare system. And finally, one of the great consequences of having a segregated healthcare system, now this is a complicated chart. It looks as if it isn't, but there's many things that impact this. But certainly if you were a commissioner of corrections in front of the House Ways and Means Committee, you'd be taking this to demonstrate that you need more money for corrections in your state, regardless of the state you are in the United States. So the middle line shows the decrease in census in public psychiatric hospitals. So as you can see, there's a dramatic decline starting in the mid-50s till around 1976, 79, and then it crosses with the growth in the correctional population. And then the top line shows what the overall rates of institutionalization are in the United States. It is quite true that as a result of sort of failed mental health policies and the lack of treatment opportunities, real treatment opportunities for individuals, that we have seen a cross-institutionalization of individuals from state hospitals into corrections. Now, there is one caveat to this chart that I feel compelled to speak about, and that is also one of the other changes in here is sort of the imposition of mandatory minimums, particularly around addictions and marijuana and the use of cocaine and the like. So that does impact this a little bit, but the chart in and of itself does suggest that our mental health policies need to be retooled for the future so that individuals who need treatment are not incarcerated.